Hello, welcome to Health Talk. I'm Dr. Manny. Nearly 20 million Americans are defined as the sandwich generation, a population caught between their aging parents and their growing children. And as the pressures to care for every family member grows, help will be needed. And here today is Hillary Thorpe from Partners in Care with some tips on how to choose the right home health care for your family. Hey, welcome. Tell me, this is such an important topic because, this sandwich generation is dealing with family members now that are aging. When is it time to get home health care at home?
Depends on the circumstances. If you're caring for mom and dad and they're showing a progression in terms of health care needs, they're declining, then you want to start looking for home health care at that point.
But I mean, like, who should decide? Should the daughters and sons, or should it be a dialogue? Because sometimes, I remember when my mother was getting up in a few years, there was a little bit of a debate whether she should move in with my sister, she should, things like that. So, should it be a unilateral decision from the family, or should you get the parent involved? The
parents should definitely be involved. Unless they are involved, they're not going to be on board with this. They're going to resist.
Okay, so I decide, my wife, my mother, and me, we're going to get either a visiting nurse or a home health aide to come to the house to care for my mother. What credentials am I looking for from that individual?
You are looking for someone who is coming in as associated with a licensed home care agency. And the affiliations from the licensed home care agency, you are actually working with the license from that agency. So this person will be trained and in providing the kind of care that your particular needs require. So affiliation.
All right, so never take a freelancer from the street or from a newspaper ad. Always go to an accredited agency that is licensed by the state that you live in.
Yes.
Okay. Those people that work for that agency, what kind of screening do they have?
Well, depending on the agencies. Some agencies do background checks. They do.
Are there minimal standards?
Minimal standards.
Okay, so
yes.
What are the minimal standards that you should be looking for?
That they should be screened by I-9, that they have eligibility to work here. They should be screened for criminal background investigations. Some people screen through the FBI, some screen just the state and city, but it depends on the agency.
But what about what kind of testing? Should they be vaccinated against hepatitis B? Should they have had a frequent biannual AIDS test, tuberculosis test? I mean, what kind of medical things are we cleared?
We're screening for the tuberculosis. We're screening for the hepatitis B, hepatitis C, and we're also vaccinating those who are not hepatitis B and C. We're vaccinating so that they can, because they can also develop that by coming into somebody else's home. The AIDS test, we can't test them for that because that's their right. It's their right to privacy.
So you don't routinely test home health aid workers for AIDS?
No.
Okay. What kind of services can they provide at home?
Okay. The registered nurse, licensed practical nurses can provide whatever care they would provide in a hospital under their scope of practice. The home health aide will be providing hands-on physical care, the activities of daily living, meaning helping the person to bathe, helping the person to get dressed, taking them out for a walk, helping them to prepare meals or preparing the meals for them if they cannot do it for themselves.
From the nursing perspective, you said that they can do what they're trained in their scope of service.
Yes.
So are they under direction from physicians' orders?
They will be.
Okay.
Only the nursing and allied health, such as physical therapy, they need physician orders to work in the home. The home health aide do not.
Is it important, or can patients interview the aides or the nurses that come into their home as to whether or not there is a personality, something that doesn't click?
Yes. I highly recommend interviewing. Some people may not want to interview because there's a cost associated with that. But if they interview, then they can say, I'm not sure that I want to work with this person.
Wait, let me jump in something you just said. So if I call an agency and I said I want an aide from my mother to help her in her daily living, and they send me somebody, and I said, well, I want to interview her first, that's going to cost me?
Yes.
All right, so nothing comes for free.
But we're flexible in terms of if I send you someone without an interview and you just don't like that person, I will send you someone else until we get that right mix, that right fit.
How do we make the decision from going to a visiting nurse or a home health aide to a nursing home? I mean, what are the criteria that people say, you know what, our services, you know, let's say if you were an agency, and you are,
yes.
I call you, you come to my house, you look at the clinical scenario of my mother, and you say, listen, your mother would not do well with us. You know, what is it that you would tell patients to look out for in order to choose a nursing home?
A nursing home. If the patient has skilled nursing needs, meaning they have wounds that needs to be cared for on a regular basis, a daily, an hourly, skilled nursing need that cannot be provided in the home, that's when we recommend a nursing home. We talked about the wounds. If we have someone who has to have diabetes checked on a daily basis, maybe 3 times a day before meals, the home health aide is not allowed to do that. And if the person cannot do it for themselves or direct the home health aide to do it, then they need skilled nursing care.
How about, do you ever take into consideration the space that people live in? I mean, so far as, you know, if they live in a cramped apartments or if they have a lot of stairs where there's going to be a lot of physical movement on this, you know, on this individual. Do you take that into consideration?
In terms of going to a nursing home, no, because that would not be criteria for admission to a nursing home. That is probably where we would need to make some modifications to the home. And so we'll go in and we'll make recommendations as to how you can modify the home to best suit the needs of your loved one.
Let's talk about, I mean, because you guys do terrific work, but this is something that always pops up, which is, you know, there have been a lot of reports on elderly abuse. What would you tell the sons and daughters of people that have visiting aides and home nursing? You know, look, if you see these things, you have to suspect abuse and you need to report it. What are the things that, you know, are important for people to realize?
Well, one thing that comes up a lot is that you'll find that the elderly person does not want to speak in front of the aide. They have things to tell you, but they want the aide to be out of the room. They'll indicate with their eyes that I have something to tell you, but I need to be alone with you. If you're finding your elderly person wearing the same clothes 2 days in a row and they're hungry, they smell, that could be signs of elder abuse. So really lack of
care is one of the telltale signs. Well, thank you so much, because this is indeed a growing problem and people have a lot of questions about this topic. Thank you so much for coming to the program. And if you have any health topics you want to talk about, email me here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.